Well, I am so pleased to have with me Dr. Scottie Day, honors alumnus of the University of Kentucky and alumnus of University of Kentucky's College of Medicine and head of pediatrics. Scottie, welcome.
Thank you. Appreciate you having me on. Happy to talk with you today.
And I'm doing these interviews with our alumni who have been a part of responding to the COVID crisis. But first, just to get a little bit of a context in your background, we've had a chance to get to know one another since I arrived and we began the Lewis Honors College. You're a member of our board, but you've got a very powerful personal story growing up in a fairly small town in Kentucky before coming to the university.
Yes, I grew up in a town of Hyden, Kentucky, and came to the University of Kentucky, and then I was a Singletary Scholar prior to going into medicine. So, and it was pivotal. Following that, I did internal medicine, pediatrics, and then did pediatric ICU. Practiced outside the state, and then returned to Lexington, Kentucky, about 9 years ago. And now I serve as the physician in chief for Kentucky Children's Hospital and the chair of the Department of Pediatrics.
It's impressive what you've accomplished already in your young time. If we could just for a moment, as an undergraduate, was this always your goal? You knew you were going to come in and be pre-med and do that, or what was your undergraduate experience that helped guide and direct
You
you
know,
into your profession?
absolutely. I've known since a young kid I was going to do one of two things. One is play music. Two was to be a doctor. And so I had a pivotal point in my career where I had an opportunity to do one or the other. But really, I felt like that I'd been called for a long time to
Mhm.
do medicine. And so, coming into undergrad, I spent the first 2 years at a community college, which was wonderful when it was part of the University of
Mhm.
Kentucky system. And then I came into UK, and it was just so pivotal. I just knew I wanted to do medicine no matter what it took. It was kind of a passion of mine since I was a small child, that and music. And I still play music, but medicine is my career. Music is a hobby.
And you use the word calling, and I know you to be someone who feels very strongly that the gifts you've been given are then to be given back to the community around you. And I can think of no time like the present where you're being called to this. So with the novel coronavirus being a new virus to humans and the disease being COVID-19, mostly impacting those who are older, what are you seeing? I mean, it is clearly medically affecting some who are children who are would be in your realm. But what is the scope of what you're seeing in pediatrics here at the University of Kentucky?
It's early on for us. I actually am fortunate to be elected as the president of the Kentucky American Academy of Pediatrics, representing the pediatricians of the state of Kentucky, and on the a board for the section on critical care nationally. And part of the things that we're seeing, it is not affecting kids. It's very unlike the swine flu or any of the previous, where the children, especially those young, are being affected. The ones that are being affected, there are cases across the country now, and we're really early on. And so we've not seen that in those children yet. The biggest issues I think that are facing, and as we've discussed, I've been asked in the last couple of days to do a fair amount of interviews, is
Hmm.
how the whole lifestyle's changed in children. So if you think about it, we live in a state, I'm going to give you some bad statistics here. We're the
Hmm.
number one for abuse. We have one of the highest rates of suicide in teenagers. All of these things that typically we are building an army, working with the state of Kentucky, working with school systems to be able to wrap around all of these people, right? At current time, that's hard to do because those army of teachers and counselors are no longer interacting with those children. So we've had to figure out ways, and under just a tremendous amount of leadership from Dr. Newman and some of the healthcare to be able to get telemedicine into homes, right? Because we can't have those kids coming here, but how do we get our adolescent division out there so they're still interacting? Because that's the key. How do we know these kids? And in many ways, some of the questions I got recently was, well, what about screen time? You're supposed to cut screen time, right? I mean, you're only allowed
Right.
a certain amount depending on the age. This is different than any time in our history. We talked about what's happened in the recession. During the recession, we saw higher rates of depression, higher rates of child abuse. But what do we really do we've never seen an issue where that we've had kids social distancing, and really, how do we make sure those kids are coming through it? Because even adults, this is completely different for adults as well.
Hmm. And we're hearing a lot. The governor has his 5 p.m. briefings, and they've done some various videos and things. Since there's less of a concern that the students or the children, excuse me, I'm so much in the university mindset, that the children will. It's not that they won't get infected, but they might not get the same kind of health impacts. They themselves might infect others. Of course, that's one of the challenges with not wanting them around older relatives. What's your recommendation then? Obviously, they've got to do some screen time because that's what's going on in terms of classwork. That's a major way to occupy their time. Um, and even when I was a kid, we just didn't have this many opportunities for further distraction. We would have gone outside and played, even if we were by
Yep.
ourselves. There just would have been. That hasn't been the mode for our children of this generation. So, what are your recommendations to families and parents right now?
What I would say is that it is important to have monitored screen time. So don't just let them go and do whatever. I do think though, having those opportunities for them to Skype or Zoom or like we're doing right now, to have that
Hmm.
interaction is key. Physical wellness, emotional wellness, psychological wellness, they all go together. I also think that the difference too is that many parents, those that are able to keep their job, are working from home. So there's a lot of
Right.
considerations about distractions as well. Right now you've got, multiple children in the home. You have both parents possibly working out of the home. Even worse would be that if they weren't able to work at home.
Hmm.
So, it's really a time to keep children think a little bit differently, to not be rigid. Because one of the reporters asked me earlier, they were like, well, tell me a little bit about discipline and, how that's
Hmm.
being affected. And I'm like, well, in many ways, adults are having difficulty dealing with it, right? I mean, we don't even understand why we're socially distanced, or, we know during economic hardships for many in the industry right now, they are trying to figure out how they're going to get food on the table if this lasts more than a couple of weeks, right? And so so just having patience. Maybe your child who never does anything wrong, that's throwing something across the, you know, room or something, maybe it's their reactions, because children have very, very different reactions to things than with us. So
Well, and that's what I was going to comment on. So, for those adults who are fortunate enough to be able to work from home, continuing to have their financial income, but if they're not, the stress and strain of this. I mean, my wife and I were living in New Orleans in after Katrina, or just outside of New Orleans, but I was working at Tulane, and our children were really young. Now, we were fortunate; the university was able to continue to keep us employed, but we saw all around us families where people who were in service industry, people who had jobs that they simply couldn't do now, and the stresses that put within the home, the tempers that would flare. How do you, as a healthcare professional, how are you all as the group of pediatricians? I mean, you mentioned, for example, um, working to uh, do telemedicine, to be doing these, using the screens to get into the home and so forth. And I know on the adult level, I've been reading stories about how some women are using code words when they go to a pharmacy to let somebody know if there's spousal abuse going on. So I know you particularly care about the mental health of children at this point, since the physical effects of COVID are less likely to be as large on them, but their parents and all of these environmental health issues. What are some of the recommendations that you have for parents? What are you all doing to be aware and to try and help the children?
working through groups like Prevent Child Abuse Kentucky, Kentucky Youth Advocates, Face It, CoSare Charities, we're working as a group. We were working on this anyway with Dr. Howard and the Forensic Child Abuse Pediatrics group, to be able to get the information out there, get the hotline out there, right? One eight seven
What
seven Kentucky Safe. And that
what
hotline,
give that again? 1877.
KY Safe, and I'll have to get you. I can
One
send
eight
you
seven
that.
seven KY safe, and we'll look when we edit it to put it in here as well.
And I think one is, if you're out and about walking socially distant in the park and you see a child or you see something questionable, give a call, because as you know, a lot of our social system aren't able to visit, right? They're
Right.
not able to do
Hmm.
those in-home visits. And I think that the governor and the whole group is really working hard to figure out how we can do this, because it's a different time. If you look at the number of foster children, the number, the ramifications, and I don't want to get caught up because there's so many positive things that have come through this, but thinking about how the adoption system, the foster system, all these things that are at least
Hmm.
moving some children through and getting them into the right place, all of that's on pause right now. I mean, it's not that you can't, but it just becomes really, really challenging, because you can't do an in-home study, and that just doesn't affect the children of Kentucky. That's an international effect. If you think about even the international adoption, I mean, it is these are things that, in many ways, I'll call them the silent victims. And I'm trying, we want negative emotions to lead to positive actions, and I can give you so many examples of positive things that have come out of this, right?
Hmm.
But I think being aware these are out here, and really encouraging teachers, and I think our teachers in this state are doing a phenomenal job connecting with these children in ways that they could have never imagined having a classroom, but really thinking outside the box. But also, this is the future. We're going to get through this pandemic. It's going to be challenging, but we've got to look at how do we still take care of the children that's going to be the future, and the families as well.
Well, and finally, Scotty, I wanted to ask you, how do you take care of yourself? I mean, you are quite literally on the front lines of this. You are engaged daily. We hear your phone binging. I'm sure there are a lot of demands on your time. How do you take care of yourself and your family? What are some of the things that you're doing?
Yeah, and I'm probably not on the front line as many as so many of my other colleagues, and my wife, as a as a physician, we kind of use the balance of doing that. We try to protect our dinner time at nighttime now,
Hmm.
which I highly encourage for all families to do. We have discussions. My wife has our children actually journaling every day. Every day they'll put something in the journal,
And
and I would
how
highly
old are
encourage.
they?
They're
How early?
14, 12, 9, and 7.
Okay, so there's quite a range, but you're still having them think through what are their feelings and what they're experiencing.
Right, because unlike any other, especially in the older teenagers, unlike any other time that things have happened, we are so connected that they
Mhm.
are aware, right? I mean, you basically can't pull up Google without seeing something, right? And so,
Mhm.
and a lot of that journaling, it's interesting. Like, some will journal, and you'll hear and say, "Well, I can't see my grandparents," and start kind of understanding why can't they have those interactions. Or, it may be simple too. It may be, when am I going to be able to do this, or when am I going to be able to do that, and understanding kind of why are we not having play dates right now?
Right.
Why not do that? Why not go to the public playground? And I think
Right.
understanding some of that is key. So, but back
So
to the
you're,
wellness question.
yeah,
Go
yeah,
ahead.
exactly.
Um, faith is very important in my life. It has been for a long time, and connections to that. I play music, play soccer, do a lot of different activities to keep me busy. So
Very good. Well, I can't thank you enough, certainly for what you're doing for our community. And I'm very proud to know you and consider you a friend and a colleague here at the University of Kentucky and within honors. But the work you're doing now is phenomenal. So thank you, Dr. Scottie Day.
well, thank you very much. I think it's so important for the information and to give us a venue to talk a little bit about the children. Obviously, we're not necessarily on the front line taking care of the critical care adults, obviously, but also being able to take care of those families and children. There's not a greater honor than the job I get to do every day.
Thank you.